Next up, speaking of people who are eminent multitaskers, Evan Watson, if you can join us. Evan is a med student at the U of C, and I don't know how, but on the side of his gurney, he is doing all kinds of wonderful harm reduction advocacy as well too, flying to Ottawa, talking to politicians everywhere, meeting with fire chiefs and much more. So over to Evan.
Thank you all very much. I second Michael's comments about you and Substack. It is incredible. I'm sure you can tell from his passion that he writes in the exact same way. It's pretty amazing to read. It's really nice to meet all of you. My name is Evan Watson. I just want to thank you for making the space to allow me to be here today. It's really meaningful for me to be back here in Treaty 6. Like you, and I live in Treaty 7 territory, but I was born and raised here, and I grew up most of my life here, and it's just really impactful to be here and to be a part of this conversation today, so thanks a lot for that. As Michael was mentioning, I'm a medical student and I'm a sociologist, and the reason why I'm a part of this panel is that some colleagues and I have created a proposal that we believe can significantly move the needle on the drug poisoning crisis in a positive direction. I want to temper that by saying this is, of course, not a panacea. I think as we saw with Jeanette's proposal, there's not one size-fits-all solution to what we're facing. But one of the things that we're trying to be is strategic about the infrastructures that we already have in place so that we can actually do something about this in the here and now. The other thing that I think is significant about our proposal is that it's about building back power in social services. And these are social services that have been under the weight of defunding, of stigmatization, of stripping away under austerity politics, and as we're seeing, increasing privatization. And so one of the ways I think that we can really start to have a meaningful impact when we start to talk about addressing the drug poisoning crisis is about trying to figure out how we bring these social services together. Before I talk about this proposal, though, I think it's really important to be explicit about positionality in any discussion like this. And so when I say positionality, what I mean is being explicit about who I am, where I come from, and why I come to this topic in the way that I do. And I do this for two reasons. Number one, as the film should have made abundantly clear to all of us, when we talk about solutions to the drug poisoning crisis, they're not legitimate if they're not led by people who actually use drugs or by community organizations that support them. For far too long, these individuals have been completely delegitimized, sidelined in these conversations or spoken above. The problem is that's not only incredibly harmful and stigmatizing to these individuals, it's actually just really stupid. We have individuals who are the best source of information for us when it comes to trying to determine how we adequately respond to a crisis that all of our society is facing, and we can't be delegitimizing these individuals anymore. It's just unacceptable. And so in saying that, I just want to be clear that the proposal that I will be talking about today means absolutely nothing if it doesn't happen in co-constitution with affected communities, and I hope that you would hold that to account. The other thing that I want to talk about when it comes to my own positionality is just that I come to this topic out of a sense of deep anger and frustration. And as you know, we love to think of ourselves, I think, as happy Edmontonians 99% of the time. I look out across this room and I see a lot of anger and frustration as well. And I don't think that's a bad thing. In fact, I think anger is adhesive. I think it sticks us together. And I think when it sticks us together, it actually gives us a platform from which all of us can actually address building a society that we know that we are deserving of. And so for that matter, I think this is really important. I hope that we can find some common ground on this topic, and I'm really excited to tell you kind of what's next for us. So for me, I came to harm reduction through this community called Camp Pekawewan, which many of you might be familiar with. I was a researcher and as well was involved in harm reduction initiatives within this community. And Camp Pekawewan was a community that was an Indigenous-led space of healing for over 400 individuals who had been experiencing homelessness due to very ridiculous decisions by our provincial government at the time to defund one of the largest emergency shelters that we had. And as a result, the entire burden was taken up by a young group of youth who basically started this camp out of almost nothing, providing shelter and care to over 400 individuals, all of whom were suffering under this compound intersecting weight of continued colonial displacement, profound levels of income inequality, unbelievable levels of poverty and criminalization and delegitimization that comes with all of that. On top of that, quite obviously, an increasing and escalating toxic drug supply. At the time, I saw this toxic drug supply as the crystallization of all of these forms of social inequity. I think the main thing I realized out of it as well is just that our complete failure to respond to the toxic drug supply at the time is akin to our social abandonment of these individuals who need our help the most. And so I took my frustration to medical school, as you can kind of see on the other side of the screen here. Myself and a group of colleagues recently went to Ottawa, where we advocated federally for drug decriminalization. And again, as Janetta was mentioning, this is but one small step in the pathway towards us actually doing something legitimate about this drug crisis. I would love to tell you that that trip stymied my frustration. It didn't at all. It actually just magnified it, made it even more aggressive. Through meetings with MPs and senators, I'm sure that you can predictably manage how those went. But most of them left me feeling as though what we were trying to sell them on was pure fantasy, and which in our minds was completely evidence-based policy, and we were hoping that we could actually find a sympathetic ear in the process. And so since going to Ottawa, I think the thought that's occupied my mind this entire time is, if even preliminary evidence-based interventions, like we were proposing with drug decriminalization, are treated by those in positions of power as pure fantasy, and these are people in positions of power able to actually meaningfully respond to this drug poisoning crisis in a meaningful way, then why don't we as a community just double down on the fantasy? And why don't we just try and make that fantasy very believable? And so with that, that's kind of my segue into what we're trying to do with our proposal, which is just speaking fantasy to power. This is a map of Edmonton. It's quite an exciting map, actually, the very first time I saw it. Every single dot on this map represents a fire station in the city. As you can tell, these dots are very equitably distributed, sort of all across the city. There's sort of a common saying, every Edmontonian lives within, I think it's a 4-minute drive to a fire station. And I found this really profound because I got thinking about this map and how when we think about fire emergencies, we think about them as things that affect our entire community. We want these to be equitably distributed spaces. We want them to be widely accessible to everyone. We want them to be community health hubs for people that they can go to and get access to information that they may need. And as we face a toxic drug poisoning crisis, a toxic drug poisoning crisis that's affecting the entirety of our city, our team got thinking, why don't we see fire services as better allies in this mission? And so one of the things that we got in the back of our minds was, what if we talked to fire services to see if it would be possible to implement safe consumption sites attached to the adjacent infrastructure of fire stations? So the idea is not to actually put an SCS in a fire station. I think for many in the audience, you'll see the problems with this, whether or not it's even just having the room for it, but also, there's many broken relationships between fire services and people who use drugs, and for very good reason. But our idea was that these places are positioned on ideal pieces of municipal land. There's plenty of space for them. They're municipally managed, and I should say municipally and federally funded, and you'll note that I didn't say provincially, allowing us to get around a lot of those sort of antagonistic relationships that would hold up a project like this. And so in our mind, we were like, wow, this is pure fantasy. Wouldn't this be amazing if we could get this off the ground? And of course, going back to my original point, these would be run and administered by community organizations and people who use drugs. The whole point is this would be done in co-constitution with municipal management so that these could be well supported, not at risk of being torn down. It would involve broad cross-social sector partnerships between healthcare, fire services, community organizations, with the ultimate idea that these are emergency response sites for primary prevention of overdoses before they even happen. So we took this fantasy up the chain, so to say. We've spoken with municipal leaders in cities across Canada. We've spoken to fire chiefs. We've spoken to federal MPs. The feedback that we've gotten is not only that there is a pathway to make this happen, but that we absolutely must do it. And so I'll sort of leave you with that, because I love a cliffhanger, I guess. But the one thing I just want to mention, it's a little bit blurry. My email's on the bottom. There's a lot of us here in this room who I know come to this topic from various points of view. Oh, that helps. Thank you. Infrastructurally, or otherwise. You may have different professions that you work in. You may be involved in different organizations. As you can imagine, getting something like this off the ground is going to take a village. If you think that you have a toolkit that could be beneficial to this project, I really encourage you to reach out to me. I'll be hanging out all evening as well. Come up, say hi. I'd really love to chat. But it's going to take a lot of people to try and make something like this actually become reality. And we really, truly believe that it can. The last thing I just want to say is we left Ottawa feeling like we were speaking fantasy to power. And I have to say that when it comes to the drug poisoning crisis, I actually think that's precisely what we need to keep doing. We've tried truth for a very long time. We've presented evidence-based solutions, and they've gone, in many cases, nowhere, have been completely sidelined, as Ewan mentioned, by provincial governments who are interested more in ideological arenas than they are in actually listening to the facts. And so my argument now is that we need to actually just speak fantasy, and we need to be proud of it. Thanks a lot.